Today's live stream is on the topic of echolalia. All the information below came from the California Scottish Rite Foundation website. In the article, echolalia, what is it? Causes, symptoms, and treatments. Families of children with echolalia, a complex communication disorder, often associated with conditions like autism, often seek support and resources to help their loved ones thrive. What is echolalia? Echolalia is a communication disorder categorized by the repetition or intim- sorry, intimidation or sorry, intim- basically repeating of words, phrases, sounds that are heard by another person or the environment. It is often associated with various neurological conditions, including autism, Tourette syndrome, and certain types of dementia. There are two main types of echolalia. We have immediate echolalia. In this form, individuals repeat words or phrases immediately after hearing them, almost as if they are echoing the speech of others without necessarily understanding the meaning of the words, beyond the words. And then we have delayed echolalia. Delayed echolalia involves the repetition of words, phrases, or sentences that are heard previously, sometimes even long after the initial exposure to the language. This can include repeating lines from movies, books, or conversations that occurred days, weeks, or even months earlier. Echolalia can serve various functions. Some individuals with echolalia use it as a way to communicate or express themselves, while others may engage in echolalic behavior without apparent communicative intent. It is essential to understand that echolalia can be part of the communication repertoire of individuals with certain conditions, and it may not always reflect a lack of understanding or meaningful conversation. Speech therapists and other healthcare professionals often work with individuals with echolalia to develop their communication skills and help them use language more effectively. Treatment strategies may include teaching functional communication skills, reducing echolalic um, responses, and improving overall language comprehension and expression. How does echolalia affect children? Echolalia can affect children in various ways depending on the underlying cause and um, the individual child's specific characteristics. Here are some of the ways in which echolalia can impact children. Oh, hello. Communication difficulties. Echolalia can interfere with a child's ability to engage in meaningful communication when a child primarily repeats what they hear without understanding the context. It can be challenging for them to express their thoughts and needs and emotions effectively. And I can agree with some of this stuff because when I was working with different neurodivergent kids, and this little boy, um, one of the little kids I was working with, he's autistic. Um, he would have me, he would go, have me, he would repeat over and over this one phrase in this show because he really liked it, which I understood. I mean, I didn't realize that's what echolalia, I didn't know what echolalia was until was exposed to it. I do realize I do some of these, I have done this behavior. There's nothing wrong with it. I'm just saying. Um, where am I from? I'm from Maryland. Expressed. Okay, next one is limited expressed language. Children with echolalia may struggle to um, initiate conversation or convey their own thoughts and ideas. They may rely on echoing phrases they've heard as a way to respond or participate in discussions. Social challenges. Echolalia can impact a child's social interactions. Peers and adults may find it difficult to engage with a child who predominantly echoes speech, which can lead to social isolation or misunderstanding. Hello. Difficulty in functional communication. Um, Echolalia may not always serve as a functional communication. Instead, it can be repetitive behavior that does not convey meaningful information. It can be frustrating for both the child and those who are trying to communicate with them. Learning implications. Echolalia might interfere with learning, particularly in educational settings. It may hinder a child's ability to understand and respond to classroom um, instructions or assignments. Stress and anxiety. Some children with echolalia may experience anxiety or frustration when they struggle to effectively communicate, and this can lead to behavioral challenges or emotional distress. Diagnosis and intervention. Echolalia can be a feature of certain developmental or neurological conditions such as autism. And me myself, I am autistic, also dyslexic and an ADHD. Um, Honestly, I didn't know. Let's be honest, I didn't know. I'm glad I'm learning about this because I didn't know all of this stuff until I researched it. Identifying and understanding the underlying condition is crucial for appropriate intervention and support. It is important to note that not all echolalia is the same, and the impact on children can vary widely. Early intervention and speech therapy are often beneficial for children with echolalia, as they can help the child develop more um, functional communication skills, improve language comprehension, and facilitate better social interactions. The specific approach to intervention will depend on the child's diagnosis and individual needs. Parents, caregivers, and educators play a significant role in supporting children with echolalia by providing a supportive and understanding environment and seeking professional guidance when necessary. What causes echolalia? Echolalia can have various underlying causes and is often associated with certain neurological, developmental, or psychological conditions. Understanding the cause of echolalia is essential for appropriate intervention and support. Some common causes of echolalia include autism. Echolalia is frequently observed in autistics. It is considered a common feature of autism, especially in children. Of course, we know this is not just echolalia is not just seen in children; it's also seen in adults. But I guess the way it shows up is it varies. Autistics may use echolalia as a way to learn and practice language, as well as to communicate their needs and desires, even if they don't fully understand the meaning of the words they repeat. We have Tourette syndrome. Some individuals with Tourette syndrome experience echolalia behaviors, including involuntary repetition of words or phrases. These repetitions are known as echopraxic. I think it's echopraxica. I think is how you say it. Um, Number one, we have a delayed developmental delay. Echolalia can be a characteristic of language development delays. Children who experience delays in acquiring language skills may use echolalia as a way to interact with and learn from their environment. Number two, language disorders. Children with special language disorders may engage in echolalia as a part of their language difficulties. These disorders can affect language comprehension and expression. Number three, neurological conditions. Echolalia can also occur as a result of certain neurological conditions or brain injury. It may be associated with damage to a specific brain region involved in a language processing and communication. Sorry for my typos and my grammatical errors and my reading grammar maybe not always making sense, but I do have really bad anxiety when it comes to reading things out loud from a past wound, emotional wound. So sorry about that. But also I am dyslexic on top of that, so it doesn't make it easier. Number four, anxiety and stress. In some cases, echolalia may be triggered or what's it called? What's the word? My brain is losing it. I'll just skip over the word. Okay, so In some cases, echolalia can be triggered by stress or anxiety and can serve as a coping mechanism in stressful situations. Number five, psychiatric disorders. Echolalia can be observed in psychiatric disorders such as schizophrenia or obsessive compulsive disorder, or OCD. Number six, mimicry and social learning. Sometimes echolalia can occur in typically developing children as a part of their mimicry and social learning process. They may repeat words or phrases they hear from others, particularly when they are trying to acquire language skills. It's important to note that echolalia can manifest differently in individuals, and the underlying cause can vary from person to person. Additionally, not all incidences of echolalia are indicative of underlying disorder. In some cases, it may be a temporary or age-appropriate behavior that is diminished as a child's language skills develop. Oh, I'm glad you're finding this interesting. I mean, for me, I like learning new things about different disabilities and different, what's the other word? Different things. I know it's probably weird, but that's just part of being Mariah. When echolalia is persistent, significantly impacts communication and is associated with other developmental concerns. One moment. Let me finish this. Let me finish this statement, then I'll respond to what you said. Um, it is it is advisable to seek professional evaluation and guidance for speech language pathologists, pediatricians, and other healthcare professionals. They can help determine the causes and develop an appropriate intervention plan tailored to the individual's needs. You said good morning and how I'm doing. I'm doing okay. Oh, I'm glad you like my art. Oh, thanks so much for that. Okay. So, what are the treatments for echolalia? Treatments for echolalia typically involves a. My brain is losing it, so hold on one second. A comprehensive, individualized approach tailored to the underlying cause and specific needs of the individual. Speech therapy, led by speech language pathologists or SPLs, SLPs, said that wrong, is a cornerstone of treatment. Hold on one second. Where am I at? Okay, yes. SLPs work with individuals to improve their language and communication skills, targeting both expressive and receptive language abilities. Functional communication training, or FCT, is widely used behavioral intervention for reducing echolalia in autistics. It focuses on teaching alternative functional ways to communicate needs and desires, therefore reducing reliance on echolalic responses. Uh, Visual support such as communication boards and visual schedules can aid in communication to reduce the need for echolalia, particularly in individuals who benefit from visual cues. Social skills, social skills training can help individuals with echolalia learn how to engage and communicate in conversations and interpret non verbal cues and interact effectively. Additionally, augmentative and alternative communication, or AAC, devices like speech generated devices and communication apps can provide individuals with limited verbal communication skills as need to express themselves. These treatment approaches often I'm not. I've learned not to deal with the trolls. Thank you so much. I appreciate you for the encouragement. Okay, last line. Sorry. Express themselves. These treatment approaches often employ in conjunction with one another, aim to encourage communication and improve the quality of life for individuals with echolalia. I appreciate you, King Roo, even though I don't know you. I think this is the first time you've been in my live stream. Just so you know, if you have any questions, let me know, and then I'm going to tell you what I want to tell you for next week's stream and Monday stream. Um, honestly, I've had a lot of trolls and haters, but I also have a lot of supportive people. And I recently realized let's not let the trolls win because I know they're trying to, and I know some people want me to stop doing this channel because it inspires other people, and some people hate when people inspire other people. Anyone have any questions before I say what Monday stream and next week's stream, and also about this poll that I have that I think some of you may be interested in possibly voting on. Yeah. So, any questions? And thank you for everyone that's watched so far. Honestly, I think this is the most I've ever had in one stream. It's kind of insane. I don't know why this is happening, but it must be good then, I assume. Um, so we'll see. I'm assuming no questions. Okay. So there's a poll that's currently available where you can vote for the topic that you would like to see for a special live stream for reaching 1.3 K subscribers. In the event of a tie, I will be doing the top two options on 2 different days. So right now I do have a tie between um, writing a poem with my community's help, and songs that I sing based on what the community decides, which I'm terrified about. Um, and what else? That is one of the polls, and then I'm gonna put up a poll next week to decide what days and times where we can do that poll. I do special streams every 100 subscribers. So when we get to after we get to 1300, when we get to 1400, I'll do another special stream. I do streams. Oh yes, the next fun unscripted live stream is on Monday, March 3rd at 6 p.m. Eastern. And I do streams every Monday at 6 p.m. Eastern, and those are a lot more, like, I think they're all better because I get to be myself and it's not scripted and I'm not reading from like my computer, and like people get to see more of myself and stuff. And the community decides a topic. Typically they don't mind me just speaking, but some people probably want me to do things. So yeah. Um, that's every Monday at 6 p.m. Eastern. And then next week's scripted live stream will be on Saturday, March 8th at noon Eastern, and that will be on the suggested topic of generalized anxiety disorder. And this actually was a suggested topic. I do cover suggested topics on videos and live streams. This was suggested by one of my this topic was suggested by one of my subscribers. So I mean, next week's topic is suggested by one of my subscribers, which is I love getting I love doing suggested topic over my own. Not that mine aren't important, but I think oh hello, it's more. I think it's really awesome when the community gets to decide what they want, and yeah. So right now I have so that's all I have. Thanks, guys, for watching. Love you guys. Hope you have a good rest of your weekend. Bye.